Welcome to Books for Success. Today, we're unraveling the insights from Breath by James Nestor. Journey into the world of the art of breathing. Take a fresh look at the mundane breathing activity and discover the healing powers of inhaling and exhaling. You'll learn the source of breathing problems, startling effects of mouth breathing, the easiest path to happy longevity, 3 wellness breathing techniques. If you like our content, hit that subscribe button and ring the bell for notifications. Don't be shy to smash that like button if you discover something valuable. Let's grow and succeed together. Let's start. Breathe to live healthily and live to breathe right. James Nestor's life gradually collapsed. He suffered from stress and the effects of severe pneumonia. His doctor advised him to take breathing courses. Thus began a journey that changed his life. The abbots of the course taught their students a method called Sudarshan Kriya. The participants were asked to close their eyes, inhale slowly through their noses, and exhale slowly, focusing on their breath. The instructor said that each inhalation supplies us with energy, and exhalation frees the body of old, stagnant energy. At first, Nestor did not track any changes. But when the practice was over, he was surprised that he felt very hot. It was as if he had run a marathon. The day after class, Nestor felt calm and relaxed. As it turned out, the art of breathing can do amazing things with the body and human capabilities. Nestor got acquainted with free divers who can dive to a depth of 30 to 90 meters while holding their breath. Breathing was their medicine and a mechanism by which the body reached new possibilities. Nestor also found special breathing techniques in ancient Chinese manuscripts dating back to 400 BC. They said that breathing could both destroy and heal. Still, many doctors and scientists are sure that air simply provides our livelihoods and does not have unique perks. However, our ways of breathing get worse every year. Improper breathing may lead to many health issues, both physical and mental. But we can avoid them with simple inhalation and exhalation. Being at the top of the food chain has led us to have breathing problems. Breathing problems have plagued James Nestor for as long as he can remember. His airways were terrible, as his skull, mouth, and larynx had atrophied. These problems led Nestor to Dr. Jayakar Nayak and his experiment. According to the experiment's first phase, he was to live with silicone plugs in his nostrils, which forced him to breathe only through his mouth. In the second phase, he would breathe through his nose, perform breathing exercises, and undergo tests that record changes in his condition. The impulse of mouth breathing occurs when we experience problems with the nose. The nose purifies the air, ridding the body of unwanted bacteria, and warms and moisturizes the incoming air. Improper breathing reduces the nasal cavity's volume, leading to an obstruction of the airflow. Due to the narrowing of the nasal cavity, bacteria multiply in the nose, causing infections and colds. Oxygen is the source of life and development. But 1.5 million years ago, our airways began to deteriorate. Evolution gave us noses for heating and purifying the air. In comparison to modern man, our ancestors did not suffer from snoring or sleep apnea, suspension of breathing during sleep. Their airways were wide, and their jaws and teeth were healthy, even though they had never used a toothbrush. Over time, food processing and preparation have weakened the facial muscles, and the brain has developed and taken up more space. The new, small nose was less efficient at filtering the air. The body became more morbid. And malocclusion, misalignment of the teeth, became the norm. Although these changes brought us to the top of the food chain, they also made us weak and vulnerable. Shortly before the experiment, Nestor met another participant, Anders Olsen. He settled in the neighborhood, and together, they recorded their health indexes and did physical and breathing exercises. Olsen insisted on doing bike exercises in each experimental phase to check stamina levels. However, even a quiet pastime seemed to torment Nestor because breathing through his mouth made him feel terrible. Difficulties and shocking effects of mouth breathing. Athletes know more about breathing as it is essential to any exercise. There are 2 ways to get energy from air and food: aerobic, with oxygen, and anaerobic, without air. Anaerobic power, a byproduct of glucose decomposition, is less effective than aerobic and negatively affects the body, causing weakness and dizziness. You've probably felt this after too much exercise. However, When your body warms up, it switches to aerobic respiration and readily accepts stress. Coach Phil Maffetone, who worked with leading athletes in the 1970s, developed an individual training program based on heart rate. Thanks to the program, athletes constantly stayed in the aerobic zone, trained more efficiently, and recovered faster. Here is a trick for discovering your target heart rate while doing sports. Subtract your age from 180. If you stick to this number throughout your workouts, you'll stay in aerobic condition. Meanwhile, Nestor's mouth breathing experiment continued. He was always tired, his sleep, snoring, and apnea indicators worsened. He also noticed that his mental capacity had deteriorated. An investigation conducted on rats in Japan proves this. When they were forced to breathe through their mouths, their efficiency in passing through a maze was obstructed. The same goes for humans. Many people try to breathe through their mouths when exercising. This tendency makes doing sports like cardio harder and more demanding. Nestor also recalls Eagle P. Harvold's experiment with monkeys. He put silicone plugs in the noses of wild monkeys. During the 2-year test, their muzzles became deformed. When Harvold later relieved the monkeys of the plugs, they relearned to breathe through their noses, and their jaws regained their previous shape. Normal breathing through their noses brought them back to a happy life. Eventually, James Nestor got rid of the silicone plugs. At home, he flushed the sinuses and inhaled deeply through his nose, enjoying all the smells. At that moment, he realized the importance of correct and complete breathing. The easiest path to happy longevity is breathing through the nose. In a new phase of the experiment, nose breathing and exercises, James Nestor set out to repair all the damage done to the body by breathing through his mouth. Using your nose for breathing makes the tissues there more elastic. Speech therapist Ann Carney advised sealing the mouth with duct tape at night. You can use tissue-based surgical tape. A postage stamp-sized piece pasted over the middle of the mouth is enough. This method helps open the nasal passages. Nestor finally got enough sleep and was no longer tormented by snoring. Western society only learned about the benefits of nasal breathing in the 19th century via the artist George Catlin. He traveled to study the life of the Native American tribes. These people had amazing physical characteristics. They were strong, beautiful, and physically fit, and their teeth were incredibly straight. The Indians explained that breathing through the mouth distorts the facial features and makes the body sick. They believed attractiveness increased if they breathed through the nose. The same went for their body strength. Catlin suffered from respiratory diseases during childhood, but breathing through his nose improved his health. In 1895, physician Richard Kaiser described the phenomenon of the nasal cycle. He noticed that nasal tissues alternately contract. Breathing through the right nostril activates blood circulation. It's a call to action that stimulates logical thinking. Breathing through the left nostril, on the contrary, lowers blood pressure and eliminates the feeling of anxiety. The left nostril is responsible for creative and abstract thinking. In 2015, scientists from San Diego recorded the condition of a woman with schizophrenia. It turned out that she breathed much more often with her left nostril. Once she learned how to breathe through the right nostril, her condition improved, and her hallucinations disappeared. Alternating breathing has a positive effect on well-being. Try this practice. Inhale with your right nostril and exhale with your left nostril several times. It keeps the body and mind in balance. The positive effect of carbon dioxide on the body is underestimated. The more efficiently the lungs work, the longer people live. You can increase your lung capacity through physical activity. For example, free divers expand their lungs by 30–40%, and even regular cycling can increase volume by 15%. In the 1940s, conductor Carl Stuff taught his choristers how to exhale through the development of the respiratory muscles. After a few sessions, the students' voices became higher and stronger. One day, he received a call from the tuberculosis department of the War Veterans Clinic. The patients suffered from emphysema, degradation of the lung tissue. Stuff realized the problem was that they were using the wrong exhalation technique, and they could not exhale the stale air. He also found that their diaphragms worked very weakly, affecting the airflow's speed and strength. Stuff treated those patients by massaging their necks and chests during slow exhalations, trying to wake up their diaphragms. But it was impossible to cure them of emphysema. It's irreversible. But as the patient's lung capacities increased, it became easier for them to breathe and move, and one 55-year-old man was even discharged from the hospital and sailed away on a yacht. Thus, stuff showed how improving the technique of exhalation can improve health. Carbon dioxide is another underestimated element in the healthy functioning of the body. Anders Olsen argued that increasing its content in the body can cause weight reduction and even decrease diseases. Carbon dioxide helps the body get better oxygenated by dilating blood vessels to deliver more oxygen to cells. Rapid breathing expels carbon dioxide from tissues, reducing blood supply to muscles and organs and causing weakness and dizziness. But slow breathing allows the body to be equally saturated with oxygen and carbon dioxide. Olsen demonstrated the work of this exchange. He breathed slowly, taking 6 breaths instead of 18 per minute, inhaling through his nose, and releasing air through his mouth. His carbon dioxide level rose to a healthy number, while his oxygen level remained consistently high. James Nestor also tried this technique and found that slow breathing promotes greater endurance in the body, which helps exercise be more effective. Did you know? The lungs lose about 12% of their volume between the ages of 30 and 50. The main problems of modern people and how to solve them. In recent years, people have begun to overeat and breathe too often. About a quarter of the population suffers from chronic diseases caused by hyperventilation. However, exercises can allow us to develop the habit of breathing less. This is not the same as breathing slower. By accustoming the body to work with a lower breathing volume, we increase the maximum oxygen consumption rate, which develops sports endurance and longevity. The exercise aims to train the body to feel good while increasing carbon dioxide levels. In the future, this will allow better absorption of oxygen. Ukrainian pulmonologist Konstantin Buteyko developed the technique of conscious refusal of deep breathing. In the 195 OS, he conducted a large-scale experiment to teach patients to do limited breathing. As a result, both healthy and sick participants noted improved well-being. Their high blood pressure and migraines disappeared. Try the control pause, one of the Buteyko methods. Sit up with a straight back. Pinch both nostrils closed with your fingers. Exhale softly out of your mouth to the natural conclusion. Using a timer, start it and hold your breath. When you feel the desire to breathe, pause the timer and slowly inhale. Then repeat. Asthma is another disease of our time. It causes the airways to constrict and spasm in response to irritants such as dust and cold air. Excessive breathing can also cause asthma. Nestor met David Wiebe, a 58-year-old luthier of cellos and violins, who had severe asthma. He trained for 3 months in limited breathing, which allowed him to reduce his inhaler use to 1 per day, and he nearly stopped feeling the symptoms of the disease. One more common problem is malocclusion. As humans grew food and developed crops, their teeth and mouths began to deform, blocking their airways. Over time, this phenomenon has acquired epidemic proportions. Food processing has stripped it of minerals, vitamins, and other nutrients. In the early 20th century, dentist Weston Price focused not on the benefits of ancestors but on finding a cure for modern people. He discovered that the reason for the deformation of the oral cavity is the lack of symbiosis of all the necessary vitamins and minerals. But he missed another essential ingredient: chewing. As food became softer, the jaws did not fully engage, and the face degraded quickly. So, James Nestor recommends chewing gum to strengthen your jaw muscles. How to widen your airways and discover Breathing Plus. Many modern people have a curvature of the nasal septum or other problems with the nose. In such cases, people go to surgeons, but sometimes doctors can remove too much nasal tissue. The nose loses its ability to filter and moisturize the air, causing empty nose syndrome. Paradoxically, too much air makes people feel suffocated. Therefore, Nestor decided not to solve his nasal problems with the help of surgery but delved into the study of the oral cavity. The blockage of the airways is mainly dependent on the mouth. The smaller it is, the more the tongue, uvula, and other tissues block the airway. In addition, according to Nestor, modern orthodontics exacerbates the situation and further reduces the oral cavity. While many doctors disagree with this theory, dentist Mike Mew believes that the oral cavity can be corrected through breathing exercises. His exercise is called mewing, A video with detailed instructions is available on YouTube. In summary, you close your mouth so that your teeth barely touch. Place your tongue against the soft palate and keep your head straight. Your spine should resemble the letter I when sitting. Use your abdominal muscles for breathing. Also, James Nestor tested the expander of Dr. Theodore Belfour. It does not align the teeth but stimulates the expansion of the oral cavity and chewing efforts. As a result, the author's lower jaw position was corrected, and the pus in the maxillary sinuses disappeared. Nestor proposes to try out the practical breathing methods, Breathing Plus. They consist of controlling breathing and consciously putting the body under stress or relaxation, depending on the needs. Breathing helps to prevent both relaxation and anxiety. For example, during the Civil War, soldiers en masse suffered from diarrhea and a crazy heartbeat. They had a nervous system disorder. It is responsible for a kind of rescue service for the body, in contrast to the parasympathetic system, which is responsible for relaxation. The ability to control breathing will allow you to manage even the most intense stress. 3 Wellness Breathing Techniques. Instructions. James Nestor chose to try the stressful breathing method on himself. This technique, Tumo breathing, allows the body to learn to respond flexibly to stressful situations. The Tumo breathing instructions are as follows. Grab a pillow, rest your head, and try to relax. Take 30 deep, quick breaths through your nose, inflating your belly. When exhaling, empty your stomach first and then your chest. After the 30th breath, exhale naturally, leaving some air in your lungs, and hold your breath for as long as possible. Inhale and hold your breath for 15 seconds. Exhale gently and repeat the exercise at least twice. Also, expose yourself to low temperatures several times a week. Tumo popularizer Wim Hof could sit in an ice bath for almost 2 hours and run a marathon at 40 degrees Celsius without a drop of water. He knew how to readjust his body's energy with the help of breathing. A more extreme form of Tumo is a method developed by Czech psychiatrist Stanislav Grof. It involved deep and rapid breathing, accompanied by loud psychedelic music. This method evoked mystical visions in patients and even provoked the separation of the soul from the body. Ancient Chinese scientists suggested getting rid of fears by holding your breath. They believed that it helped calm the mind and relieve anxiety. The third method of Breathing Plus is Sudarshan Kriya. It involves the control of prana life energy, with the help of breathing. It requires total commitment and consists of 4 phases. Mantra. Limited breathing, short inhalation, long exhalation. Controlled breathing. Inhaling and holding the breath for 4 seconds, exhaling for 6 seconds, and holding the breath for 2 seconds. The final phase, intense breathing for 40 seconds. Many breathing techniques can improve your well-being. Choose one that appeals to you and record its impact. Or try all of them and stick to the one that gives you the best results. Conclusion. The possibilities that breath gives us are vast and impressive. But James Nestor emphasized that breathing is not a panacea for all diseases. It cannot heal us when doctors prescribe antibiotics. However, it effectively combats asthma, stress, autoimmune diseases, and headaches. Breathing also helps maintain a healthy balance in the body and is suitable for preventing minor illnesses from developing. Breathing practices work best with a healthy diet, physical activity, and stress management. Make the following rules a part of your daily routine and feel a qualitative change in your life. Try to breathe through your mouth as little as possible. Air should be absorbed through the nose, passing through filtration, humidification, and heating systems. Breathe through your nose and savor every smell. The air passed through your nose makes you healthier. Make every exhale good. Exhale as much air as possible from your body by breathing slowly. Do not forget about the oral cavity. Developed jaws positively affect the respiratory tract. Chew a lot. Don't be afraid to add tough, raw foods to your diet. Try to master Tumo, the method of intensive breathing. Befriend your breath and the air around you. Hold your breath to relieve anxiety. Take care of yourself, make breathing practice your daily routine. In the first stage, do not take risks with long breath holdings. If you feel dizzy while breathing in and out slowly, stop and rest. Try this. If you suffer from nasal congestion, try the following method. Sit up straight, exhale freely, and pinch both nostrils. When you feel oxygen starvation, inhale slowly through your nose. Continue controlled breathing for up to a minute. Repeat the exercise 6 times. Thank you for joining us on this enlightening journey. If you've enjoyed our summary, consider reading the full book for a more in-depth exploration. Before you go, hit that like button, subscribe if you haven't yet, and share this video with someone who could benefit from these insights. Until next time, keep reading, keep learning, and keep growing.